UltraShape is the safe, fast, and comfortable way to shape and slim your body. It's a non-invasive treatment that instantly and permanently breaks down unwanted fat deposits that are hard to get rid of with diet and exercise. UltraShape delivers focused, pulsed ultrasound that selectively and immediately destroys fat cells at a designated location without harming skin, blood vessels, nerves, or connective tissue. Your body's own metabolic processes naturally clear away the destroyed fat cells, just like during weight loss. Safe and effective, UltraShape has been clinically proven for treating problem areas like the abdomen, thighs, and flanks, with no downtime. Within 2 weeks, after just 3 UltraShape treatments, you'll see an average circumference reduction of up to 4 centimeters for a visibly slimmer appearance.
The UltraShape treatment uses focused pulsed ultrasound to immediately and selectively destroy fat cells beneath the skin without surgery, discomfort, or downtime. Once the transducer is positioned on the surface of the skin, ultrasound energy is delivered. Acoustic waves of energy are focused at a point 1.5 centimeters below the skin's surface, similar to how a magnifying glass can focus a point of light. Focused ultrasound causes rapid changes in pressure and creates bubbles in the fluid between fat cells. These bubbles implode from rapid changes in pressure, causing the wall of the fat cell to rupture. UltraShape resonates at the specific frequency that most affects fat cells. As a result, the UltraShape treatment only targets fat cells, leaving surrounding tissue such as blood vessels, connective tissue, and nerves unharmed and protected. Patients experience little to no discomfort during or after treatment, and results can often be seen as early as 2 weeks, with best results after a series of 3 treatments 2 weeks apart.
Live from Studio 46, this is CBS 2 News.
Coming up, a new weapon in the Battle of the Bulge.
It's that little pooch that I just cannot get rid of.
The new non-invasive, pain-free techniques just approved by the FDA to melt away the fat.
You work out, you diet, but you still can't get rid of that belly or those love handles. You don't want surgery. CBS 2's Dr. Max Gomez has a solution. Just approved by the FDA, it literally melts the fat away.
Does this sound familiar?
The lower abdomen area and like the love handles.
Tried crunches, tried exercising, and it just doesn't go away.
Like so many other women, both Brianne Fleming and Jackie Akbar don't really have a weight problem. They have a too much fat in just a couple of spots problem. Neither wanted invasive liposuction, and other non-invasive techniques produced minimal results and had drawbacks.
The freezing technology would create numbness or pins and needles, and the heating technology, the ultrasound, was very painful.
But now the FDA has just approved 2 new devices to shrink those fat pockets. Vanquish, which uses radio frequency, and UltraShape, which uses high-intensity focused ultrasound. Both are said to melt fat, although that's technically not true.
We're actually breaking up the fat cells so the body absorbs it naturally, and it stays away for good.
This year alone, 45 million Americans were openly tortured. 20 million suffered agonizing boredom. 10 million were publicly humiliated in the process. And what do they have to show for it? Stop the torture. Start getting a great body with painless UltraShape ultrasound.
Welcome to the Laser Skin Care Center. My name is Dr. Bryna Kane, and I'm the senior partner here. I've been in practice for almost 30 years in the Long Beach area, and I'm proud to be here today and tell you about our practice. Since the inception of our practice, our philosophy has been dermatologic procedures provided by the dermatologists. We feel that those who've been trained in skin diseases in all subspecialties within our specialty are the ones who should provide the care to the patients. Here at the Laser Skin Care Center, our philosophy is that we treat patients as if they're family. I was taught very early on, not only from my family, but from my professors, that if you treat people as you'd like to be treated, you can't go wrong. And our philosophy is family first. So all those patients here are treated as if they are family and provided with what we as physicians and dermatologists would provide for our own families and ourselves. As a patient, when you arrive at the Laser Skin Care Center, you are greeted by our wonderful front office staff who will provide you with the necessary paperwork to put you into our electronic medical system. Subsequently, you will be ushered into your room where you will be waiting for your physician to come and have your initial consultation. As a new patient, when you call for your appointment, we will select the appropriate physician who can take care of your dermatologic needs. All dermatologists at the Laser Skin Care Center are trained in all aspects of dermatology, but some of our physicians have expertise in certain areas. For example, if you call and want to have a skin cancer screen and some moles evaluated, you will be ushered into your room, provided with a gown, and at that time, your physician will come and assess the situation and provide you with a treatment plan and diagnosis. Subsequently, you will be provided with other appointments so that we can either remove the moles and or reassure you that all you need is follow-up. Once we have decided that, for example, you need a surgical procedure, we provide you with an appointment in a timely manner and schedule you with our front office. You're also provided with the appropriate paperwork necessary to put you into our electronic medical record database and to be able to go online so that you can see many of your pathology reports, etc. In addition, our office is unique in that we're the only dermatologic practice in the area that provides in-house pathology, and our own dermatopathologist provides slide reading for your quality of care. As a dermatologist in practice for almost 30 years, my goal is to provide quality care for our patients and to surround myself with dermatologists in our practice who are handpicked, who I would feel comfortable having provide dermatologic care for myself or my family. My philosophy has always been, as said before, treat patients like you want yourself treated and like family. As stated previously, I have pediatric training, and so I do both adult and pediatric dermatology. The focus of my practice is general dermatology, skin cancer identification, and small surgical procedures, as well as some skin cancer surgery. We're very blessed in that we have a wonderful patient base, and many of our patients provide us with more patients in that they're satisfied with their care, so they reach out to their family and friends and they refer patients to us. For many years, we never even advertised, and word of mouth was our best advertisement. Having said that, our wonderful colleagues in the greater Long Beach community and beyond also provide us with a great source of patient referral, for which we are very grateful. I'm also very proud that we provide community service to the Long Beach and greater Long Beach areas. In 1997, Dr. Glassberg and I co-founded the Erase the Past Gang Tattoo Removal and Youth at Risk program. This has been provided to the Long Beach and Greater Long Beach youth at risk from 1997 for 14 years. And Dr. Glassberg, I, and our associates have removed over 5,000 gang and youth at risk tattoo removals. In addition, we have provided 38% of our graduates with a new life. They've erased their past and rematriculated into society. We did this at no charge to the participants, and since we believe you can't get something for nothing, we made them provide 5 hours of community service to either benefit themselves or the Long Beach community with the assistance of the Park and Rec Department, the Long Beach Police Department, and Memorial Medical Center. For each 5-hour volunteer, they got a tattoo removed. We're very proud of this, and at the present time, we are working closely with the Memorial Medical Center, City of Long Beach Police Department, and the Department of Park and Rec so that we can reestablish our program and get some new machinery and go forward. We're very proud of our staff, who are also hand-selected by our physicians. Many of our staff have been with us for over 15 years, and again, part of the family spirit of Laser Skin Care Center. Our staff are friendly, they are all professional, qualified, and certified to provide you with the best care in dermatology. Our facility here at the Laser Skin Care Center is the only facility between UCLA and the Beckman Institute in Irvine that provides comprehensive care in all areas of dermatology. Not only do we have state-of-the-art lasers, which are the most up-to-date and recent, provided by dermatologists, but we also have brachytherapy, which is localized radiation therapy for certain types of skin cancers. In addition, our 2 Mohs surgeons are Mohs certified trained and have the highest credentialing available in the United States. In addition, we have physicians who have fellowships and expertise in laser dermatology, as well as adult and pediatric dermatology, skin cancer surgery, and cosmetic dermatology. We are very aware that you, our patients, have many choices in the community that provide dermatologic care. But we hope that you, as the consumers, are informed consumers and realize that here at the Laser Skin Care Center, the quality of care that you are being provided in all areas of dermatology by dermatologists is the top, academic affiliated, and certainly the best provided in our area.
Hi, my name is Dana, and I am 39 years old.
Hi, I'm Tammy, and I love playing basketball with my kids and hanging out with them.
Hi, I'm Kathy, and I'm a mother of 4 children.
My name is Rachel. You know, my mother told me never tell your age. A woman should never tell your age, so secret.
3 things in my life that keep me youthful are my kids, number 1. Actually, number 2 and number 3. My kids keep me young.
I play basketball with my son. I'll take every minute that I can with them.
I always thought that the wrinkles were the sign of getting older, but a few years ago I noticed my cheeks were starting to sag.
I don't feel old, so why should I look old? When I talked to my doctor, I learned that as we age, our faces lose volume.
And that can make you look older. My doctor also told me that Juvederm Voluma XC could help my cheeks.
My biggest fear of the Juvederm Voluma XC treatment was the results. I didn't want to look fake or plasticky.
I'd never done anything like that before, and I just was uncertain. I was hoping for really just the more youthful version of me.
The results are pretty dramatic. After the Juvederm Voluma XC treatment, my face looks much fuller, but really natural.
I have fuller, rounder cheeks. My face is less sunken.
My daughters actually came to me and said, "Mom, your cheeks look really full and natural."
Not trying to look 40 or even 30, I just wanted to look the best that I can be today.
Since I've gotten the Juvederm Voluma XC treatment, it feels amazing. I'm excited about it. I'm looking forward to 40. I think I'm entering the best part of my life.
The Fraxel laser is part of a new type of technology. It's been around 5 or 6 years, continues to be refined for the rejuvenation of the face, neck, arms, hands. It's a breakthrough in laser technology in that the laser is delivered with fractional amounts of energy, hundreds and thousands of small pulses of energy to the skin, which allows some skin to be spared, which accounts for the rapid healing and low downtime with the procedure. It's used for reversing and improving the effects of sun damage, primarily including brown spots, textural changes, uneven skin, fine lines and wrinkles, and also can refine pore size. It can be used on the face as most traditional rejuvenation lasers. However, because of the breakthrough in the technology, it can also be used off the face, which is a new aspect of this laser technology, including the neck, chest, hands, and arms. Typically, the patient is treated with a series of treatments, anywhere from 2 to 5, depending on the condition being treated. Laser can also be used for improving acne scarring, which typically takes more treatments, somewhere between 4 and 6. We often combine Fraxel with other techniques to get a more complete facial rejuvenation, including the use of various filler agents, Botox, and sometimes Ultherapy, which has a lifting and tightening effect in addition to rejuvenating the skin surface with the Fraxel. We use a variety of fillers in the office. Fillers encompass a pretty large range of products. We carry all and utilize all of the different types of products. The deep fillers such as Sculptra, Radius, and Voluma help to rejuvenate the tissue loss and soft tissue volume loss of the mid-face, upper face, and restore youthful appearance. Fillers such as Juvederm and Restylane are used more for medium to fine lines around the laugh lines, face, below the corner of the mouth, and for hollows under the eye. And a newer filler called Bellatero is used for very fine-tuned fine line correction, such as vertical lip lines and fine lines around the eyes. We combine and mix the various fillers just depending on the patient's needs.
Why do I use Restylane? To lose these wrinkles and my inhibitions.
I use it to hide my real age. Because he thinks I'm younger than I am. I use it to look good. Even in fluorescent lighting.
Restylane is the #1 selling injectable dermal filler in the world. It restores youthful volume to smooth away facial wrinkles for natural-looking results. Typically, in one visit to your doctor. Restylane corrects the lines from your nose to the corners of your mouth. Redness, tenderness, swelling, and bruising may occur after injection and normally go away in 7 days. Ask your doctor if Restylane is right for you.
I was prompted to get the Ultherapy treatment because I was, for the first time, looking my age. I work in an area where ageism in Hollywood is prevalent, and that's not just people in front of the camera, that's even for people like me who are a makeup artist. You know, and I'm working on a lot of young, beautiful girls. I don't think they want this old hag putting their makeup on. And I was starting to feel haggard. And I don't like a lot of injectables. I think you start to look funny and silly. I just wanted things to go back where they were. I was at that point where I thought, oh my gosh, really, am I gonna have to face this? Am I going to have a blepharoplasty and, you know, have my eyelids done? And also too, in what I do, I like to get creative with my own makeup. It's over now. It's gonna be boring. Once you get those saggy eyelids, there's nothing you can do. Having that eyelid space, I don't have to have surgery. It's amazing. I love it. It's exciting. My results, as they gradually went on, how I started to notice them was I did notice the very next day when I woke up. But then I kept noticing my skin getting tighter and tighter and firmer. And I knew it was better. I knew it was a lot better. But until I saw my before and afters, did I really realize, not just from the initial treatment to, you know, a month or two later, but when it was 3 or 4 months later, I think because you do look at yourself every day, and it is gradual, you don't necessarily realize what it has done. A lot of people keep asking me, or different clients who see me regularly will say, have you lost weight? You've lost weight, haven't you? I'm like, no, I haven't. I wish I could say I have. And then it dawned on me, the only thing that could be different was the Ultherapy.
I first became interested in dermatology as a medical student. I was doing research and got involved with the emerging field of laser technology. The research was very interesting, and I was lucky enough to get in on some early prototypes and clinical trials, and that really stoked my interest in the field. I then began to realize how varied the field was, that it includes the combination of medical and surgical and aesthetic techniques, and is always varied and interesting. Also the amount of gratification from helping patients and being able to cure many of the conditions we see and improve patients' health and remove their skin cancers and improves their aesthetic appearance is very gratifying. Over the years, I've come to know my patients extremely well and seen the benefits of them coming in routinely, getting checked, having their skin cancers removed. And many of our baby boomer patients start to age a little bit, and we can improve their appearance and confidence levels. And it's very gratifying to be able to approach the patients on many different levels from a medical as well as the aesthetic standpoint. At the Laser Skincare Center, we have an amazing staff. We have 13 nurses and medical assistants who are highly trained, many of who have been with us for 5, 10, 15 years, which shows their dedication to the practice and their loyalty and their wonderful interaction with patients. Our front office staff is also amazing, and we have an incredible staff doing our pathology lab, which is a new addition to the practice over the last 2 years. We are unique in the sense that we have virtually everything in-house. We have our own pathology lab, our own Mohs surgery suite. We have our own dermatopathologist, and in addition, we are now able to perform limited radiation treatments on more difficult skin cancer cases. Our facility is unique in the sense that we have everything housed under one roof. We have aesthetic and medical and cosmetic and surgical services. We have our own in-house pathology lab. Extremely helpful for quick turnaround of pathology and allows us to do our Mohs micrographic surgery in the office. We also have multiple and comprehensive aesthetic technology, including about 10 lasers and light-based devices within the office.
The man who pioneered the science of skin health now pioneers the next generation of skin health solutions. From the innovative mind of world-renowned researcher, educator, and board-certified dermatologist, Dr. Zain Obagi, comes an entirely new, thoroughly comprehensive system of treatments, protocols, and products that create and maintain healthy skin. Advanced, complete, and continuous in-home cosmeceutical solutions, developed under the guidance of the man whose concepts and philosophies originated the science of skin health more than 30 years ago. Today, Dr. Obagi's decades of groundbreaking work form the foundation of ZO Skin Health Corporation, featuring ZO Skin Health products, a complete array of solutions and programs for maintenance, daily skincare, and skin protection, formulated to sustain the positive results of therapeutic treatments and enhance skin health in every kind of patient, regardless of age, ethnicity, gender, or skin type. Dr. Obagi once again raises the bar for creating healthy skin with bold new protocols, advanced new treatments, and effective new products. 30 years in the making.
It's comprehensive care. It's continuous. It's my full circle of skin health solutions.
Experience the next generation of skin health solutions with ZO Skin Health Corporation.
Welcome to Laser Skincare Center. My name is Dr. Joanna Chan. I grew up in Texas and attended Harvard College, Stanford Medical School, and residency at UT Southwestern in Dallas. Following residency, I went to California Skin Institute, where I completed a Mohs micrographic fellowship, which is for skin cancer surgery and facial reconstruction, in addition to cosmetic surgery. In 2012, I joined Laser Skincare Center as a full partner, and I've had this as my home ever since. So Mohs micrographic surgery is the best treatment for skin cancer when you want to minimize injury to normal skin. So what happens is the cancer is removed with a very small margin, but processed in an entirely different way. Normal excision is removed with a margin of 4 to 5 millimeters and processed with bread loafing, so the specimen is randomly cut. And that means about 1% of the tissue edge is examined. By contrast, in Mohs micrographic surgery, the specimen is removed with minimal margin, but processed like a pie, where we examine the entire crust of the pie. And that lets you examine 100% of the tissue etch while you wait. The tissue is frozen and processed quickly and mapped out. So we actually track the tumor with a microscope so that each individual cell is removed. This allows you to have 100%, almost 100% cure rate, 99.9%, compared to 94 to 95% with standard excision. If there is cancer left after the first stage, we are able to map it out and take out the cancer only where it's left. For instance, if it's at 12 o'clock at the top, only a small amount at the top is removed. If that is clear, then we're able to do reconstruction right away in the office without having to go under general anesthesia. When you come in for consultation for Mohs micrographic surgery, we go over the pathology report, we answer your questions, we mark out the tumor together, we discuss expectations as well as potential repair options. We often will recommend that you stop blood thinners such as aspirin, fish oil, vitamin E, ibuprofen, and possibly prescribe you an antibiotic to prevent infection. We're lucky at Laser Skin Care Center to have a pathology lab right here on premises, which means that we can get your specimens right away. It does take a few days for us to process permanent sections, but we can expedite that so that you can have your results in a matter of days. Mohs micrographic surgery describes the technique of processing the tissue. However, many people do Mohs surgery. In our office, however, only Mohs college-trained physicians do Mohs surgery, which means that we did fellowship beyond residency and did thousands of cases prior to even trying it in practice. This is in contrast to most society physicians who often take a weekend course and are then certified.
Over time, my lashes thinned.
After 40, I didn't have enough lashes. I'd heard of Latisse, but had questions. My doctor said,
Latisse is the only FDA-approved prescription treatment for inadequate or not enough lashes.
Now with Latisse, my lashes are longer, darker, with more than double the fullness in 16 weeks.
If you are using or have used prescription products for eye pressure problems, use Latisse under close doctor care. Latisse use may cause increased brown pigmentation of the colored part of the eye, which is likely permanent. Eyelid skin darkening may occur, which may be reversible. If you experience eye problems or have eye surgery, consult your doctor. Common side effects include itchy eyes and eye redness. I trust Latisse, and I use it too.
my lashes changed as I got older. Now I use Latisse. More than double the fullness in 16 weeks.
Are your lashes thinning as you get older? Why wait? Ask your doctor about Latisse. From Allergan, a company with 60 years of eye care expertise.
Hello, my name is Anne-Marie Tremaine. I'm a board-certified dermatologist and fellowship-trained in laser surgery and cosmetics. I've been at Laser Skin Care Center for 1 year, and I see both medical and cosmetic dermatology patients. At Laser Skin Care Center, we offer the FDA-approved Fraxel Dual laser treatment. What's nice about this laser is, again, we tailor it to your needs. There's one wavelength that we use to treat the deep wrinkles and lines of the face, the neck, and the chest, and then a more superficial wavelength that we go around to treat brown spots and fine lines. So with the Fraxel treatment, we'll discuss at your consultation visit how many treatments you will need. For some, it'll be just 1 to 2 treatments. Others would be 4 to 6 treatments. They often occur at every 4 to 6 week intervals. The type of laser treatment we do that day will determine the amount of downtime you have. For some treatments, it'll only be 1 to 2 days of downtime. Others can be up to a full week. So we offer the V-beam laser at Laser Skin Care Center. This is a pulse dye laser that is used to treat broken blood vessels on the nose and the legs, and also is very good for the redness associated with rosacea. It is a series of treatments that occur every 4 to 6 weeks, and there's little downtime associated with each treatment, just some minimal redness and swelling afterwards. We also offer Ultherapy, which is microfocused ultrasound. This is an FDA-approved treatment for skin tightening of the face, the jawline, and the neck, and most recently it was approved for the fine wrinkling of the chest. The goal of the treatment is to trigger deep in the tissue to stimulate your body to make new collagen formation. And several months after the treatment, you'll start to notice tightening of the skin and lifting as well. And recently, Ultherapy also gained FDA approval for treating the crepiness and the wrinkling of the décolletage. Recently, Ultherapy also gained FDA approval to treat the fine lines and crepiness on the chest. We're excited to announce that we have also added the Clear and Brilliant laser to our practice. This is another laser option that requires little downtime and can be done in quickly 30 minutes in the office. And this is used to treat fine lines, wrinkling, brown spots, and melasma. At Laser Skin Care Center, we have hand-picked skincare products specific for your concerns. After your laser treatment, I will recommend one of our premier skincare products that will help with the recovery period. I can also recommend one of our several sunscreens, such as Elta MD or our Revisions SPF. My goal as a dermatologist is to provide comprehensive evaluation and a treatment plan for all of your dermatologic concerns. At Laser Skin Care Center, we offer subcutaneous fillers. There are many different types. One of the main ones we use is hyaluronic acid. That's an ingredient that is naturally in your skin that depletes over time. We are able to inject it into the skin to revitalize, revolumize. We have many different products, and we will choose the product that is right for you. Ones that we carry include Juvederm, Voluma, Radiesse, and Sculptra. At your consultation visit, we'll decide which filler is appropriate for you. In addition, we often combine our fillers with neurotoxins. A brand name you might have heard of is Botox, and that's what we inject into the eyebrow area and around the eyes to create lift and smoothing of the fine lines. The standard of care for treating lower leg veins is sclerotherapy. I inject the medication into each vein, causing it to shrink down and ultimately resolve. Often this can require multiple treatments, and at your follow-up, I may recommend that we do a laser treatment to finish off the small blood vessels that remain.
The lines that I had here on my face prior to Restylane were deep, and I honestly didn't know what could be done about them. I hated the way they looked, and ever since I've had the treatment with the Restylane, you know, right over here on my face, they're gone. I look much younger. I wanted to show off my new look to everybody, everybody from family to friends. I've had many compliments, and recently I've ran into some friends who I haven't seen in a long time, and the first thing they said was, "You look amazing," and of course they couldn't quite figure out what was different. My greatest concern before having any Restylane treatments was probably pain or an unnatural look. After my treatment, I was able to resume normal activities. As a matter of fact, I asked the doctor if I could work out later that day, and he said absolutely. And that's what I did.
I'm sentimental, so I walk in the rain. I've got some habits even I can't explain. I go to the corner and I end up in Spain. Why try to change me now? I sit and daydream. I got daydreams galore.
Hi, my name is Polly Moore. I'm a registered nurse here at Laser Skincare Center. With one of my psoriasis patients, she's had psoriasis her entire life and didn't know there was any sort of treatment she could do to get rid of the plaques on her arms and legs, and she would cover up everywhere she'd go. She didn't want to wear shorts, she didn't want to wear short sleeves. She's tried many different therapies, topical steroids, and just tried everything, and nothing would make these stubborn plaques go away. When she came in to see me, she was just so excited that she found this treatment. She didn't care if it, maybe it wouldn't work. She didn't care if she would, come here 2 days a week. She was just so excited to try something else, and we got results quickly with her. She responded very quickly. She just was over the moon with gratitude with how we were together able to get some resolve for her, and she had significant improvement in all areas. You can hardly see any plaques at all anymore. Her skin is smooth, she doesn't itch, she doesn't flake. She's able to have confidence when she goes out. She's able to wear shorts, she's able to wear short sleeves and not be embarrassed and not be worried that people are looking at her like, oh, she has this hideous rash all over her body. She is blown away with the treatment and how well it has worked for her, and she's very pleased. She says it's changed her life.
Age doesn't look the way it used to. It's less obvious now, more gradual, subtly self-confident. Why shouldn't anti-aging be just as subtle? Discover Sculptra Aesthetic, not an overnight miracle. Long-lasting, not a quick fix. Sculptra Aesthetic is the injectable that replaces lost collagen gradually to give you a naturally subtle look without giving you away. And Sculptra Aesthetic can last up to 2 years. After all, you didn't age overnight. Why should you anti-age overnight? Temporary side effects may include injection site discomfort, redness, bruising, bleeding, swelling, or bumps. Lumps with delayed onset with or without inflammation have been reported. Bumps and lumps typically resolve without treatment. Sculptra Aesthetic. It's anti-age for the modern age.
Proven year after year, Botox Cosmetic is used to temporarily improve the look of moderate to severe frown lines between the eyebrows in people 18 to 65 years of age. Since you're sitting in the doctor's office right now, chances are you recognize the importance of getting expert advice. So there is no better person to ask about Botox Cosmetic than the doctor. And why not ask today? Come on, you've heard about it. Maybe you've had friends who've gotten treated with it. Isn't it time to ask your doctor about Botox Cosmetic? Before considering any aesthetic procedure, you probably want to get your questions answered. Questions like, what exactly are those moderate to severe frown lines? We call those moderate to severe frown lines between the brows a 1, or an 11, or a 111. Which one are you?
When I crinkle my brows, I get this one irritating line, like a groove here. So I would consider myself a 1.
Well, I've got these 2 lines right here that go straight up and down. So I guess these 2 bad boys make me an 11.
Which one am I? I guess you'd have to call mine 111. Yeah, too many lines.
Years of squinting, concentrating, or frowning can cause your skin to furrow and crease. As time passes, your skin becomes less elastic and those moderate to severe frown lines remain, even when your muscles aren't contracting.
I have sacrificed a lot over the years, and that's why it's time to do something for myself. I'd like to make these moderate frown lines between my brows less noticeable.
Ask your doctor if Botox Cosmetic is the one for your ones.
My name is Audrey Young. I am the esthetician at Laser Skincare Center. During an initial consultation, when I first meet with the patients, we come into the consultation room and I'll sit down and just discuss with the patient what kind of issues they're having with their skin, what they'd like to improve upon in their skin, and I just try to guide them on that journey, giving them a great skincare routine to start with, maybe starting with treatments with me, how we can integrate my treatments with what the doctors can offer to the patients here at Laser Skincare Center. During that initial consultation, I'll try to assess the skin as far as what the skin type is for the patient. Some patients may think they're more of a drier skin when maybe they might be more combinations. So the minute we can determine what the skin type is, then we can better customize their skincare routine for them. So I can initially do that, and then they may have particular things that bother them. Say they have a little vein by their nose that bothers them, but I may notice they have some pigmentation on their forehead, some sunspots that they could also treat. So we try to get a totality of the problem for the patient, and then either treat one thing at a time or just let them know what can treat each issue that they may have.
Health. After decades of skin cancer research, SkinCeuticals has been able to develop high-potency antioxidant formulas, concentrated in pure actives, and proven to penetrate into skin.
The skin is very good at repairing itself if you can provide protection against additional damage.
SkinCeuticals provides home care products and professional treatments to prevent, correct, and protect. In recent years, leading dermatologists, exclusive plastic surgeons, and select medi-spas have been heading towards a complete and new approach of fighting aging and improving skin health. SkinCeuticals is integrated into the medical aesthetic practice with pre- and post-procedure products to enhance injection and laser, state-of-the-art medical peels, and targeted protocols to maintain the results of clinical treatments. Daily routines that complement the benefits of these procedures will make the difference. The cosmetic world is being redefined and will become integrated. We at SkinCeuticals believe that integrated skincare is the future of beauty.
The skincare line Revision, we really like their line. They have a great vitamin C lotion that we try to incorporate with all our patients. It's great for any skin type, so even sensitive skin types respond really well to that product. And it's more of a lotion. It goes on the skin very nicely, and it's one of the most stable vitamin C's out there, so it's probably one of the most effective, therefore. We really like their line. They have a great neck cream. It's called Nectifirm. We put patients on that after they maybe have their Ulthera treatment on their neck. It really helps to maintain that result that they've achieved with that Ulthera. They use great peptides in their products. They do several studies on their products just to make sure they're very effective and that your patient is getting the most bang for their buck for that product. They also have a great sunscreen called IntelliShade, and that one's really nice because it does have a tint to it, and then they have a matte format and then an original format. So the matte format is great for people with a little bit more oilier skin types. They tend to get more oil production on the skin, so the matte really reduces that shine for the patient. A lot of women like it because they can use it as their foundation or makeup. And it has great peptides in it as well. So it's not only a broad spectrum sunscreen, it's also an anti-aging cream because of the peptides that they incorporate into that particular product. We like the EltaMD skincare line. We mainly focus on their sunscreens they offer. We have their SPF 41. It's a tinted sunscreen, so a lot of patients really like that as well because it kind of evens out the skin tone for them, so they can wear it as their makeup or just on the weekends just to kind of even out everything. And then they have an EltaMD Clear, which is an SPF 46, and that one's very popular here because it's great for acne-prone skin, rosacea skin. So people with sensitive skin sometimes are a little leery with sunscreens. They say, oh, this sunscreen broke me out, I can't tolerate sunscreen, so I don't wear sunscreen. So this one is perfect because it's a broad spectrum, it's a zinc based, so it doesn't have that white finish that a lot of people, associate with the zinc sunscreen. And it's great for that acne-prone, rosacea-prone, sensitive skin type. We also have a line here, it's called Zeo Skin Medical. It's from Dr. Zeno Baji. He recently created this line. I think the line has been out for about 3 years. We chose that line because it really helps our patients with pigmentation issues. They have several products that they offer with prescription strength hydroquinone. But what is great about their line is they now have a non-hydroquinone brightening agent called Brightenex, and that one has mainly a vitamin C base, and so it's not as aggressive on the skin, but they're still going to notice a nice blending of the skin, nice evening out of their skin tone, and it's very gentle on the skin, and they can use that indefinitely. And then they also have a great product called Retamax, and that would be their retinol cream to use at night. So using retinols help keep that collagen production going, because as we age, the collagen production significantly goes down. So using a retinol, a retin-A-based product just helps keep that skin tone nice, help with fine lines, help with wrinkles. So we feel when they combine the Brightenex with the Retamax, they're really getting an all-over evening of their skin tone and their skin texture.
I work in the cosmetics industry, and there's a lot of young people that I'm working with on a daily basis. So being 46 years old, I feel like I need to, always look my best. I had the area treated right from here, just underneath my eyes up to my forehead. Immediately I saw a small lift, especially I have very hooded lids. And it was nice, again, being in the cosmetics industry. There's so many shadows and liners that I want to try, but I felt like my lid was constantly covering that. But again, after my treatment, wow, I have an eyelid, and it looked good. And I noticed that as the weeks went on, the results just got better and better and better. It's something that people can't put their finger on, which is what I like. It's something that's natural. I don't want to look overdone. I don't want to look tight or fake or pulled in any way. So I like that it's a gradual improvement. Self-confidence is a must, especially in the dating scene in Southern California. But after I got the Ultherapy treatment, it was great. I just walked a little taller, I held my head a little higher, and it felt so good. I felt sexy, I felt glamorous, and in my business and being single, it's a must.
Today we're going to bring you through the experience of clear and brilliant skin. After the consultation with your skincare specialist, you will be ready to begin the experience with Clear and Brilliant. The first step is simple. The unique code of your single-use treatment tip is scanned by our device, indicating the level of treatment. Then your new tip is attached to the system. Based on what your skincare needs are, the specialist will then select the specific level of treatment that is right for you. Before the process begins, a shield is placed over your eyes for protection. With the selected level of treatment chosen, Clear and Brilliant is activated with the press of a button, and your experience begins. Your skincare specialist will gently glide the laser handpiece over your skin in a uniform way, which will take approximately 15 minutes. The treatment refreshes your skin from the inside out, replacing damaged skin with healthy, younger-looking tissue. The result? Clear and brilliant skin.
Hello, my name is Dr. Edward Glassberg. Welcome to the Laser Skin Care Center. I'm one of the partners of the practice and a clinical assistant professor at the UCLA School of Medicine. I've been in practice 22 years, and my training was at Harbor UCLA for my residency, and I attended the USC School of Medicine prior to that. I also did a fellowship in Mohs micrographic surgery, skin cancer removal, at UCLA as well. The Laser Skin Care Center was founded 18 years ago by myself and Dr. Brian Kane, as we were looking to initiate a practice that had a focus on both medical, surgical, and cosmetic dermatology, using the latest technology in laser medicine and techniques, including lasers, ultrasound devices, fillers, and other injectable products. My philosophy of practicing medicine is to treat the patient as an individual, to assess their needs, whether they're medical, surgical, cosmetic, or a combination, and approach the patient individually and try to help them understand, have realistic expectations of what we can do for them. When you first arrive at the Laser Skin Care Center, we will ask for some information, always allow some time for getting the paperwork out of the way. You'll be escorted to the room by one of our nurses or medical assistants. We'll then take information and try to get initial idea of your concerns, and then the doctor will come in and discuss with you your concerns, whether it's medical. We generally recommend a full body skin exam and skin cancer screening. If there are cosmetic concerns, the doctor will discuss all the options regarding your concerns, in addition to speaking with our cosmetic consultant. One of the major focuses of my practice is in skin cancer removal. I was trained in Mohs micrographic surgery and reconstructive techniques through a fellowship at UCLA. This is the gold standard for removing skin cancers that are either large or recurrent or in cosmetically sensitive areas. It allows us to remove the skin cancer with a very narrow margin with high levels of accuracy, as we utilize our laboratory to immediately test the tissue that's removed, check for residuals, make sure the patient is clear, and proceed to remove additional tissue if necessary. When the patient is done, they have the highest level of accuracy and cure rate for removing the skin cancers and the smallest potential wound and the smallest potential scar. For most micrograft surgery patients, we ask patients to be prepared for anywhere from 2 to 4 hours in the office. They come in having eaten and with something to occupy their time. There is definitely some waiting time while the tissue specimens are processed in the laboratory. All the procedures are done under local anesthesia. In general, the patients are able to drive themselves to and from the office.
My name is Anthony Lee. I'm the General Manager at the Mayfair Hotel in London. Our clientele reflects the atmosphere of Mayfair Village. Guests come from all over the world and range from businessmen wanting to wine and dine in our bar and restaurant, and couples looking for a luxury romantic getaway, to sheikhs, to rock stars, celebrities, models, fashionistas, and filmmakers and artists. To name it, in a nutshell, this is a fun place to be. What unites our guests is their desire to be connected to the young, fashionable London, and here we are. Signature suites are the jewels in the Mayfair crown. Each have their own unique style and personality. Take, for instance, the iconic Schiaparelli suite with its hot pink decor. Just epitomizes glamour and fashion.
Let's go straight.
If that doesn't suit you, then the masculine Azure suite, featuring a classic palette of blues and vintage brown leather. Right here, we're in the elegant pure white penthouse, and its magnificent roof terrace is really an opulent yet effortlessly cool place to be. A perfect venue for a luxury weekend and a very chic private dining experience. We have, of course, a fantastic spa. I would say London's premier day spa, with beautiful, tranquil, peaceful settings, tailored treatments to emphasize on the well-being and health. And if I had to choose a path of going to heaven, I would definitely choose the hot stone massage. There's nothing like it.
Welcome to Laser Skincare Center. I am Carmi, the cosmetic consultant. I'm here to guide the patient through the process of choosing the right treatment for them. So a patient will come to meet with me and we'll go over what their expectations are, what treatments they feel they need, and then I educate them on the appropriate treatments and the different options for their skin conditions or concerns. So generally, I'm there just to educate them through the process and help choose the right treatment for them. So we really try to achieve a cosmetic center of excellence so that we can guide patients through the appropriate skin health regimens, whether it's dermatology, aesthetic services, or cosmetic procedures, because we believe it is a global approach to overall skin health to achieve beautiful skin and feel natural and obtain that result for our patients. So they can opt to see the physician if they want to, but we've really worked hard on choosing the right procedures and equipment for our patients so that we all are on board with what treatments we think are the best for the patient. So they can see the physician, and they will always see the physician inevitably to decide and finalize that, but they will always end up in my chair because that's what I do. I consult patients in choosing that right procedure for them. So I'm really that person that go-to to let them know it's okay to do something for yourself. This is a normal feeling to have, and answer those questions and make sure that they have the pre and post instructions for care afterwards. And then if I do feel like someone was a little bit nervous, I could call on them and just kind of make sure that they feel okay about it.